Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic: the anterior leg muscles. The muscles in the anterior compartment of the leg are a group of 4 muscles that act to dorsiflex and invert the foot. These muscles are collectively innervated by the deep fibular nerve. The arterial supply is through the anterior tibial artery. In this video, we shall look at the anatomy of the anterior leg muscles, their attachments, actions and clinical correlations. Tibialis anterior. The tibialis anterior muscle is located alongside the lateral surface of the tibia. It is the strongest dorsiflexor of the foot. Attachments. Originates from the lateral surface of the tibia and attaches to the medial cuneiform and the base of metatarsal eye. Actions. Dorsiflexion and inversion of the foot. Innervation. Deep fibular nerve. Extensor digitorum longus. The extensor digitorum longus lies laterally and deep to the tibialis anterior. Its 4 tendons can be palpated on the dorsal surface of the foot. Attachments. Originates from the lateral condyle of the tibia and the medial surface of the fibula. The fibers converge into a tendon, which travels onto the dorsal surface of the foot. The tendon splits into 4 and each tendon inserts onto a toe. Actions. Extension of the lateral 4 toes, and dorsiflexion of the foot. Innervation. Deep fibular nerve. Extensor hallucis longus. The extensor hallucis longus is positioned deep to tibialis anterior and extensor digitorum longus. Its tendon emerges from between the 2 muscles to insert onto the big toe. Attachments. Originates from the medial surface of the fibular shaft. The tendon crosses anterior to the ankle joint and attaches to the base of the distal phalanx of the great toe. Action. Extension of the great toe and dorsiflexion of the foot. Innervation. Deep fibular nerve. Fibularis tertius. The fibularis tertius muscle is thought to arise from the most distal part of the extensor digitorum longus. It is not present in all individuals. Attachments. Originates with the extensor digitorum longus from the medial surface of the fibula. Its tendon descends onto the dorsal surface of the foot and attaches to the 5th metatarsal. Actions. Eversion and dorsiflexion of the foot. Innervation. Deep fibular nerve. Clinical relevance. Foot drop. Foot drop is a clinical sign that refers to an inability to dorsiflex the foot at the ankle joint, resulting in the foot dropping under the influence of gravity. It indicates paralysis or weakness of the muscles in the anterior compartment of the leg, and typically occurs as a consequence of damage to the common fibular nerve from which the deep fibular nerve arises. The inability to dorsiflex the foot can interfere with walking, as the affected foot drags along the ground. To circumvent this, the patient can flick the foot outwards while walking, known as an eversion flick. Now let's have a quiz. Listed below are muscles of the anterior leg, which produces eversion at the subtalar joint. Tibialis anterior. Extensor hallucis longus. Extensor digitorum longus. Fibularis tertius. The correct answer is fibularis tertius. 2. Which of the following options most accurately describes the nerve roots of the deep fibular nerve? L3 to L5, L4 to L5, L4 to S1, L4 to S3. The correct answer is L4 to S1. Thanks for watching. Like and subscribe to Anatomy Movement channel for more.